Hi, my name is Kristen Souza, a licensed mental health counselor specializing in all things ADHD. Today we're going to go over CBT and how it's used to treat ADHD. First and foremost, what is CBT? So CBT is an evidence-based therapy that focuses on recognizing irrational thought patterns that negatively influence behaviors. This is really a great treatment option for someone with ADHD because a lot of the symptoms that people with ADHD experience are negatively affecting their day-to-day functioning, maybe at work, school, and in their relationships. So the idea behind CBT is to recognize those irrational thought patterns and make changes in between to your behavior so that you can improve your day-to-day functioning. What might a CBT session look like for someone with ADHD? Well, the therapist will focus on day-to-day functioning and improving that. So often they'll go over your day-to-day routine from wake up to sleep at night and find areas where you want to improve. So this will be a collaborative process between you and the therapist. So some of the tasks can be staying on top of financial responsibilities, paying bills on time, being to work on time, getting enough sleep, focusing on sleep hygiene, eating enough food throughout the day. They can be anything. So whatever you want to work on improving your ADHD symptoms, your therapist using CBT will go over that in your treatment plan. So the cool thing about CBT specifically for people with ADHD is it heavily focuses on behavioral modification part. And this is really cool because people with ADHD show outward symptoms of it most of the time. Of course, there's inattentive type, but it's usually the outward symptoms that are causing a lot of the negative behavior in day-to-day functioning, which is negatively impacting you in different areas like relationships, work, and school. Let's go over how therapists would use CBT in a session. One of the things that we do is use a technique called SMART goals, which stands for specific, measurable, attainable, realistic, and time specific. This allows the client to know, or you to know exactly what goals you want to achieve and how you're going to get there and what amount of time you need to get there to see progress. So let's go over this in detail so you can get a better idea of what this might look like. So the S in SMART stands for specific. What exactly are you trying to accomplish with this goal? So if you want to start getting to work on time at 9 a.m., that could be your goal. You want it to be measurable. How do you know that you're making progress? So for that specific example I just gave you, how is it measurable? Well, you'll document every day that you get to work. What time? Are you getting there at 9:04, 9:10? You'll be able to see this progress over time. The A in SMART stands for attainable. Do you have the tools and resources necessary to complete this goal? Is it in grasp? Is it something that you can actually complete? If not, it'll be something that you work up to. And then the R stands for realistic. Again, is this a realistic goal? Are you wanting to be the CEO of your company by Friday? Chances are that's not really realistic. It's possible. You want to scale back a little bit and work on things that you can get done that are in your reach. And then time specific. In order to make progress, and the reason why this is evidence-based, you'll need to have a time range that you're completing these goals by. So let's go back and using the SMART technique that I just went over and use a realistic goal that someone with ADHD would want to accomplish. So let's say you're late to work every single day and your boss started to notice. So a realistic goal is you want to start getting there earlier. So let's make that specific. What time? I want to be at work by 9 a.m. every single day of the week, Monday through Friday. So the goal here is instead of just being to work on time, you're going to get to work at 9 a.m. every single day of the week, Monday through Friday. Is it attainable? Is this something that you can actually do? Can you get to work by this time? Is it realistic? Is this something that you can complete? So can you realistically get to work by 9 a.m. every day? The answer is yes. And then time specific. So let's do the whole goal together using the example I just gave you. Client will get to work every single day at 9 a.m. Monday through Friday if the client reaches over a span of 3 weeks. So you'll know that you're making progress on the goal if you're getting to work a little bit earlier every day. You're documenting that 9 o'clock timestamp. So this is how you'll know you'll make progress. Are you getting to work by 9 a.m.? So you'll document that every single day of the week. And then if you're able to do that by 9 a.m. Monday through Friday for 3 weeks, that means you completed the goal. So let's go into the cognitive restructuring part of CBT. And this is a big one for someone with ADHD because a lot of the thought patterns are heavily impacting your behaviors. And this is where CBT comes in. So a great example of this, and in my experience, is a lot of time blindness and feeling like a task is impossible to complete. These are two big ones. So what CBT will do is help you recognize that irrational thought pattern and change your behaviors in between so they're not negatively impacting your day-to-day life anymore. So let's give you a realistic realistic example here. People with ADHD have a hard time with task completion. It feels like this task is impossible. Let's say you're looking at your dishes and you have a pile of dishes and you're like, wow, that's going to take me 4 hours. So you just don't do it. In CBT, you recognize that this is an irrational thought. The dishes aren't going to take me 4 hours. And the way you can do that is perhaps setting a timer to see how long it will actually take you to complete those dishes. And over time, it'll change your thinking patterns and help you complete tasks in a timely fashion. Your therapist will help you recognize irrational thought patterns that are impacting your behaviors. And then this is where skills training comes in. Your therapist is going to give you tools to help you modify those behaviors to improve your day-to-day functioning. Some skills that would be helpful for someone with ADHD is organization, time management, social skills, and some healthy lifestyle adjustments. With time management, maybe your therapist will give you realistic tools like starting to use a timer, a scheduler, your calendar, writing things down, etc. Maybe some social skills to help you bring back the interrupting and staying on top of social events, because a lot of times people with ADHD have object permanence, out of sight, out of mind. And then healthy adjustments in your lifestyle. This is super important. So with your day-to-day routine and your organizational skills. So your therapist might give you realistic tools like sticky notes, highlighters, using different apps and things like that to help you improve your day-to-day functioning. So how fast can you expect to see results with CBT if you have ADHD? And they're actually pretty quick. If you are putting in the work, results can be seen in 10 to 12 weeks, sometimes quicker, sometimes longer, depending. But using those SMART goals that I mentioned, it helps you complete things in a timely fashion so you don't have an outstanding goal of 3 months and you're getting that done a lot quicker. So CBT and medication combined is typically the treatment that we see that works well with ADHD. However, a lot of people see drastic improvements with CBT alone, and that's something you'll have to talk about with your therapist to see if medication is the right thing for you. The combination of medication and CBT, there are fantastic results that I've seen. Okay, so what are some at-home CBT exercises that you can do if you have ADHD? Great question. Let's go over that. There are some everyday changes that you can implement in your day-to-day that use CBT techniques, and you can see progress on your own. Let's go over some CBT techniques that you can do at home that I've used all the time with my clients, and go ahead and write these down if you find them helpful. So first, create a routine. People with ADHD thrive off of routine because a lot of times people with ADHD have object permanence, out of sight, out of mind. So you want things to happen when they're supposed to happen. So set a schedule every day from morning to night. This can be on a paper calendar, on an app, whatever you use that you find helpful, do that. But first, we're going to start creating a routine. That's the first thing you're going to want to do. And then you're going to want to get organized and maintain organization daily. This is super hard for someone with ADHD because people with ADHD usually thrive from a clean working area, but have a hard time staying organized and might have piles everywhere. Totally relatable. So have designated spots for specific things. Start small. So what you can do is for your work stuff, have a pile for that. For household laundry, have a pile for that and start there. These little things can add up to bigger things over time, but if you start these habits in your day-to-day life, you'll see some changes there. So manage distractions. Someone with ADHD gets super distracted. So identify where you get distracted and use some tools. So for example, let's say you get super distracted while you're working with outside noises. Put some headphones in, some white noise, maybe make an ADHD playlist. If you do quiet music, do that. If you need some more stimulation with like an upbeat soundtrack, that's something you'll want to implement as well. Take breaks. If you learn anything from these tips that I'm going over right now, this is absolutely crucial for someone with ADHD, because with ADHD, a lot of times you get super disinterested doing a mundane task. So if you take breaks in between, this can spark up your interest in a task again and makes task completion go way quicker. So I often tell my clients to do a reward system. Let's say you get 30 minutes of work done. You're going to reward yourself with a little walk outside or maybe a tasty snack, soda, something like that. They can be any reward that gets you motivated. It can be so small, but something to reward yourself for that effort. Set goals and rewards accordingly. So make sure that your goals at home are achievable. You know, you're really falling behind on your household tasks. Start with a load of laundry every single day. And once you start completing that laundry every day, start on the next task, and so on and so forth. Search for and create positive opportunities. People with ADHD thrive off of the reward system in our brains. People with ADHD might find it really hard to complete the boring stuff at work or at school, study for a test and things like that. So you have to find the positive stuff that you excel with in between and work from there. So work on your strengths so you can create a lot more positive experiences in between of the negative ones. And then maintaining a healthy lifestyle. This one it's really hard to do if you have ADHD, but having a balanced diet is really helpful. Waking up at the same time every day, getting enough sleep, water, etc. These are all things that you can implement at home that will improve your day-to-day functioning. Final thoughts for CBT for ADHD. I find that it's really useful with a lot of clients that I've worked with. You have to be focused and motivated and keep working at it every day. I've seen fantastic progress with CBT, and you can live a healthy lifestyle if you continuously work at it. If you or a loved one are struggling with ADHD, you don't have to do it alone. Talking to a therapist that specializes in ADHD can help you understand your symptoms better. We've linked some valuable resources in the description and comments to help you find a therapist, psychiatrist, and other useful resources. Check them out.